Professor of Musculoskeletal Biomechanics at the University of Sheffield and at the Insigno Institute for in Silico Medicine. And in METASTRA, I'm the work package 3 leader, which is actually the work package to develop the computational models within the project. Yeah, so basically the work package 3 assembles a team of excellent researchers across Europe. And the team will develop 2 types of models, so data-driven, artificial intelligence-based models, and biomechanical, subject-specific, physiology-based models. And this will be the core of a decision support system that we will develop so that the clinicians can understand if a patient with vertebral metastasis has high risk of fracture, and can also use this decision support system to understand what is the best treatment for them. Yeah, so in my team at the University of Sheffield, actually it is led by myself and also Professor Lacroix. Actually, we are developing the computational models for the metastatic vertebra. So basically what we do is to take a CT scan of the patient and convert it into a biomechanical model and to predict the bone strength and the risk of fracture in a quantitative manner. Now this is challenging because the vertebral, in particular the vertebral body, has a very heterogeneous microstructure and material properties. And especially when there is a metastatic lesion, even if it's lytic or blastic, this will affect even more the material distribution within the vertebra. So it's very challenging to model this. And in particular, how we're going to do it is to take all the information from the biomedical images, so from the CT scan, to get the bone mineral density distribution within the bone and use that to inform our models. The second challenge is that we want to apply some realistic loading conditions to the vertebra. And in order to do that, we will collaborate with our colleagues at ETH Zurich that will develop a very advanced finite element model of the intervertebral disc that will be used to understand how the load is distributed to the vertebra. Finally, one more challenge is that as there are these different materials within the vertebra, we have a lot of interfaces between the bone, the lesion, and the biomaterials, so the implants that we want to use to fix the vertebra with lesions. And in this case, we will collaborate with our colleagues in Zaragoza that will actually model the interfaces and will inform our complex model of the spine segment to predict the bone strength or the vertebral strength. I think that for too long we have seen the AI data-driven based models and the physiology-based subspecific models in competition with each other in many studies. In METASTRA, we are not going to do that. Actually, in METASTRA, we are going to look at the complementarity between these 2 types of models. And in particular, how it can be used in our decision support system is that we will have a 3 levels decision. So the first level will be done by the standard clinical tool, or actually I would say the more advanced clinical tool that we have right now, which is the spine instability neoplastic score. And this clinical tool already provides information to the clinicians to what are those patients which have a very high risk of fracture and those that have a very low risk of fracture. But there's a huge zone, so I would call it a gray zone, that where basically we do not know. So the SINS, so the scoring system, does not provide any recommendation to the clinician, and the clinician is going back to his own experience. So now we want to reduce this gray zone of indeterminate cases by using data-driven artificial intelligence models, which are trained on a very, very large number of cases that we collect in our retrospective study. we expect that these models will reduce the gray zone but will not close it completely. So we will then further refine this analysis by adding for those specific cases that are still indeterminate from the data-driven models and use subject-specific biomechanical models to understand the risk of fracture in those specific cases. This will provide a unique way of stratifying patients with metastatic lesions, understanding what is their risk of fracture, and also even using the subject-specific models to test different type of treatments.